Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Pediatric brain tumors are masses of abnormal cells that generally occur in children and result from the uncontrolled growth of those cells within the brain. Okay, let's start with some basic brain anatomy. First off, there's the cerebral cortex, which is the part of the brain that's supratentorial or above the tentorium, and the cerebellum, which is infratentorial or below the tentorium. And the brain has 4 interconnected cavities called ventricles, which are filled with cerebrospinal fluid, a fluid that helps provide buoyancy and protection, as well as metabolic fuel for the brain. Highest up are 2 C-shaped lateral ventricles that lie deep in each cerebral hemisphere. The 2 lateral ventricles drain their cerebrospinal fluid into the third ventricle, which is a narrow funnel-shaped cavity at the center of the brain. The third ventricle makes a bit more cerebrospinal fluid and then sends all of it to the fourth ventricle via the cerebral aqueduct. The fourth ventricle is a tent-shaped cavity located between the brainstem and the cerebellum. After the fourth ventricle, the cerebrospinal fluid enters the subarachnoid space, which is the space between the arachnoid and pia mater, 2 of the inner linings of the meninges which cover and protect both the brain and the spine. So this makes it possible for cerebrospinal fluid to also flow through the central canal of the spine. Now, focusing in on cells within the brain, there are many different types with specialized functions. For example, neurons communicate neurologic information through neurotransmitter-regulated electrical impulses. Then there are cells that secrete hormones into circulation and regulate the functions of other cells throughout the body. These cells are found in glands, like the supratentorial pineal gland, which is located just behind the third ventricle, or the infratentorial pituitary gland located near the front of the third ventricle. There's also a category of cells called neuroglial cells that help support brain homeostasis and neuronal functions. These include astrocytes, which have cellular processes coming off their cell body, giving them a star-shaped appearance. Astrocytes are found throughout the brain and the spinal cord, and their main roles include maintaining the blood-brain barrier, providing nourishment to neurons, and recycling neurotransmitters. Ependymal cells are also neuroglial cells, and they're cuboidal to columnar, so square to rectangular shaped, ciliated cells that line the ventricles and central canal. One of their main roles is to regulate the circulation of cerebrospinal fluid. Some brain cells have a limited ability to be replaced, especially during injury, and they do it by having undifferentiated stem cells, called embryonic stem cells, in the brain activate and mature into specialized cells. Now, a tumor develops if there's a DNA mutation in any of these cell types that leads to uncontrolled cell division. Typically, these are mutations in proto-oncogenes, which results in a promotion of cell division, or mutations in tumor suppressor genes, which results in a loss of inhibition of cell division. You can think of proto-oncogenes as the accelerator or gas pedal, and tumor suppressor genes as the brakes. Too much acceleration, or an inability to brake, can lead to a runaway cell division. As a result, the mutated cells can start piling up on each other and can become a tumor mass. Some of these tumors are benign and stay well contained or localized, but some become malignant tumors or cancers, and these are the ones that break through their basement membrane and invade nearby tissues. Malignant tumor cells can get into nearby blood or lymph vessels and travel from the primary site to establish a secondary site of tumor growth somewhere else in the body, and that's called metastasis. Brain tumors can be categorized by their primary site location, as either supratentorial or infratentorial tumors, though some tumors can form in either. They're typically named by the cell type involved. So, for example, an astrocytoma is a tumor formed by mutated astrocytes. But their severity is classified or graded by the World Health Organization's scale. The scale goes from 1 to 4 based on the morphologic and functional features of the tumor cells. a grade 4 tumor being the most abnormal looking cells that also tend to be the most aggressive. But not all tumors have all 4 grades, because some tumors are basically always more benign, whereas others are just more aggressive. So let's start with tumor types that are generally infratentorial tumors, because they make up the majority of pediatric brain tumors. Overall, the most common malignant tumor is a medulloblastoma, which typically forms in or around the cerebellum adjacent to the fourth ventricle. Medulloblastomas originate from embryonic stem cells, and they tend to be extremely aggressive. One relatively unique feature is that they metastasize through the cerebrospinal fluid in a process called drop metastasis, where the tumor spreads to the base of the spine. Because of this, medulloblastomas are typically only classified as grade 4. Histologically, medulloblastomas often have a feature called Homer-Wright rosettes, which are dense tangles of neurons and neuroglial cells surrounded by ring-like structures formed by tumor cells. While medulloblastoma may be the most common malignant tumor, the most common primary pediatric tumor is a type of astrocytoma called a juvenile pilocytic astrocytoma. Because astrocytes are found throughout the brain and spinal cord, astrocytomas can form throughout these locations. But juvenile pilocytic astrocytomas are mostly infratentorial tumors in the cerebellum or near the brainstem. And while astrocytomas can be graded 1 through 4, juvenile pilocytic astrocytomas are only grade 1 because they're generally benign and slow growing. Histologically, they can have cysts or sacs filled with fluid, bodies of granular material, and Rosenthal fibers, which are fibers that clump together in the cytoplasm of the astrocytes and look a little bit like a worm or a corkscrew. Among the fibers is the structural protein glial fibrillary acidic protein that is typically found in astrocytes. Finally, another common infratentorial tumor is an ependymoma. Now again, they can form in the brain and spinal cord because that's where ependymal cells are found. But pediatric ependymomas tend to form in the fourth ventricle. Now, there are a few types of ependymomas, and they're WHO graded 1 through 3. In grade 2, classic ependymomas, tumor cells have a regular round to oval nucleus. Histologically, a prominent feature are their perivascular pseudorosettes, which are ring-like structures formed by tumor cells with rod-shaped ependymal processes, like cilia, surrounding a centralized blood vessel. Okay, so now let's focus on supratentorial pediatric tumors. The most common is a craniopharyngioma, which forms near the pituitary gland. During development, some cells migrate down from the brain and form the posterior pituitary, while some cells migrate up from the back of the throat, called the oropharynx, first forming the Rathke's pouch, and then eventually forming the anterior pituitary gland. Now, remnants of Rathke's pouch that don't mature can form craniopharyngiomas. They're typically only classified as WHO grade 1 tumors because they're typically benign and slow growing. Histologically, it's a pretty complex tumor with lots of prominent features, including multiple cysts filled with a thick, motor oil-like fluid, and cells that stratify or arrange themselves in layers. The innermost layer tends to have loosely packed cells that retain their nuclei despite being filled with keratin, a strong protein, creating what's called a wet keratin appearance. A rare supratentorial pediatric tumor is a pinealoma, which forms in the region of the pineal gland. Pinealomas primarily emerge from the endocrine cells of the pineal gland, and they can be grade 1 through 4. Histologically, prominent features include large round tumor cells resembling germline tumors, or small cells forming Homer-Wright rosettes. Now, the most common symptoms of brain tumors include headaches, nausea, vomiting, and seizures, and they're a result of the compression and destruction of healthy brain tissue. In addition, it's important to consider the cell type that's involved. So, for example, a pinealoma may lead to increased secretion of the hormone beta-human chorionic gonadotropin that can cause an early onset of puberty. In addition, as the tumor grows in size, it can compress nearby cells and structures, interrupting their normal functions. For example, as pinealomas, medulloblastomas, and ependymomas enlarge, the mass of the tumor can compress nearby ventricles, blocking the flow of cerebral spinal fluid, which causes swelling, called hydrocephalus. Generally, the diagnosis of central nervous system tumors includes medical imaging, like CT scans, but more commonly MRIs. But definitive diagnosis needs to be made based on the histologic and molecular characteristics of a tissue biopsy. Treatments depend on the tumor type, grade, and symptoms, but can include surgical removal, radiotherapy, or chemotherapy, frequently in a combination. But specific courses of treatment are guided by the molecular characteristics of the tumor based on the biopsy. Finally, the chance of recurrence gets higher in high-grade tumors and in tumors that have not been fully removed or destroyed. Okay, quick recap. Pediatric brain tumors can be infratentorial and supratentorial and form from a variety of cells. Tumor types are classified using WHO grading based on histologic and functional features. Diagnosis includes medical imaging, with a definitive diagnosis being made with a tissue biopsy. Treatments are largely dependent on the molecular characteristics and tumor grade, and can incorporate surgical removal or some combination of radiotherapy and chemotherapy. Learn medical knowledge more efficiently with Osmosis Prime, the one-stop shop for exclusive videos, personalized study schedules, practice questions, flashcards, and more. Sign up for a free 2-week trial today at osmosis.org/free trial.